Okay, so right, we can start. The topic for today's webinar is on processes in version 3.1. Your presenters for today are Don Lebitsa and Madeleine Tablanche from Vector Life Sciences and myself. We will be covering a number of different topics. If we go to the next slide. Today we will be looking at the baselines, the iterative approach, transfer of applicancies, splitting the eCTD, multiple applications, so covering replicas, clones, and duplicates, line extensions, cancellations, and withdrawals. Next slide, please. Right. So an iterative approach of building a baseline can be taken if the applicant requires additional time to provide the Module 4 and Module 5. If additional time is required, please contact SAHPRA for permission to take this approach. If approved, a deadline to complete the baseline will be issued, and the applicant will be allowed to submit sequences up until the deadline as normal, as long as the submissions do not require the content of Module 4 and Module 5 for that evaluation. If the baseline has not been completed and provided by the deadline, then all further non-baseline sequences will be rejected in screening until the baseline is provided. So when creating a baseline sequence for the first time, do add documents previously submitted in the appropriate part of the eCTD structure with the attribute new. Do not resubmit documents from previous eCTD sequences. Example, one sequence for the baseline for modules 1, 2, and 3, followed later by a sequence for the baseline for modules 4 and 5. Do use the submission type baseline in each case. Do use the sequence type initial on the first baseline sequence. Do use the sequence type supplementary information on each of the baseline sequences submitted later, and indicate the related sequence number of the initial sequence. So if you look at the example that is shared, sequence tetra 0 under submission type baseline with sequence type initial and related sequence tetra 0. Sequence 0001, the submission type here, for example, is a type 2 safety and efficacy clinical submission. The sequence type is initial. The related sequence would be 0001. Sequence type 0002 for submission type 1B quality, the sequence type is initial and the related sequence remains 0002. Sequence 0003, but the submission type here is type 2 safety and efficacy clinical. This is a sequence type response. The related sequence is 0001. Then in sequence 0004, the submission type is baseline. The sequence type supplementary information, the related sequence tetra 0. For sequence 0005, with the submission type 2 quality, where the sequence type is initial, the related sequence remains 0005. Thank you. Next slide, please. And now I will be handing over to Don to take you through transfer of applicancies. Over to you, Don.
Thank you, Pratibha. Good morning, ladies and gentlemen. So I'm going to briefly go through the TOA and the splitting of eCTDs. So we've got the new process of the relinquishing and the acquiring applicants. So if you are the relinquishing applicant, you need to make sure that when you do the TOA, you don't have any open submissions. If you do, you would need to withdraw each of those submissions separately. And then you would need to provide the up-to-date PV data separately as well. And then you can provide the letter of confirmation. We've got a new section 123. So your relinquishing letter would go into 1231. And then you need to provide the entire eCTD dossier to the acquiring applicant. Thank you, Ntokozo. Next slide. Okay, and then as the acquiring applicant, you would then submit a TOA as a next sequence, not as a 0001. So in other words, you don't need to submit a baseline except if you're doing a partial transfer. And then the letter of authorization for the handover would then go into section 1232. Thanks, Dogozo. Okay, so now let's look at some practical examples. So as the relinquishing applicant, you would submit your 0001 for your product with application number 123456. And then in the follow-up sequence, you would be responding to the SAHPRA queries. And let's say your dossier was perfect and you get your approval. And then on the sequence 3, you now starting your TOA process. You then submit your PV information and on your sequence description, then that would be for transfer of application. Thanks, Ntokozo. And then on your sequence 4, you now telling telling SAHPRA that you are now doing the TOA relinquishing, and then you provide your sequence 0001 to 0004 to the acquiring applicant XYZ. And then on the sequence 5, applicant XYZ, who is acquiring the dossier, would then submit a TOA to confirm the transfer, and they would use the same submission number or applicant number rather. That's that's a typo there. They would use the same application number 123456 from the relinquishing applicant, and then the transfer of the product from ABC to applicant XYZ would then be approved at sequence 5, let's say, for example. And then the new acquiring applicant would then continue with their business as usual with sequence 0006. Thank you, Ntokozo. So that would be for the basic TOA. It's pretty simple. There's no open submissions. It's not a partial TOA. It's pretty straightforward. The relinquishing sends in the TOA with the PV, and then the acquiring sends in the TOA, and then a business as usual with the follow-up sequence, no baseline. Right. With open submissions, you submit as the relinquishing, you would submit your 0001 as a new application, and then on sequence 0002, you get your registration. And then on your sequence 3, you submit a type 2 variation with sequence type initial, but then the TOA kicks in while you're waiting for your type 2 approval. So then you would need to send in a withdrawal of that type 2. And on your sequence description, you would then state that this is because of a transfer of application. Thanks, Ntokozo. Next one. Okay, and then on your sequence 5, as the relinquishing, you submit the up-to-date PV information, and then on your sequence 6, you then submit your TOA with submission type TOA relinquishing, and then you hand over the sequence or the entire life cycle 0001 to 0006. You send that to the acquiring applicant. And then on the sequence 7, the acquiring applicant would then submit a transfer of applicancy using the same application number, and then but they would now do a transfer for applicancy, and they would get a separate application ID. Okay, and then from sequence 08, then they do business as usual. Okay. Then if you have a partial TOA, so you've got two application numbers, 123456 and 123457. Okay, so your application folder at this point would be one under your relinquishing applicant. So you would submit your 0001 and then at 0002, you get your registration. And then at 0003, you submit your PV information with the description transfer of application. And then on sequence 0004, you would then initiate the TOA for product 123456 to the acquiring XYZ applicant, but you are retaining the 12345 as the relinquishing. So you would state that on your cover letter and your submission for the transfer of application relinquishing. Then applicant ABC, who is the relinquishing, would submit under the application ID CA at the end AA, and you would then be submitting or rather giving the entire sequence 0001 to 0004 to applicant XYZ. Next slide, thank you. Okay, then on the SAHPRA application portal, now we need to have two separate application IDs. So the current one would remain for the 123457, but we need a new application ID for the application number 123456, which is the one that's being relinquished. Then on the sequence 0005, the acquiring applicant submits a transfer of applicancy to confer the transfer using the application number 123456 with now a new application folder, CA, and then at the end the DB, not the AA. And then they submit on the portal the transfer of the product from applicant ABC to applicant XYZ is then approved, okay? And then so approval may only be issued once the expected follow-up baseline submission is provided. So who's providing the baseline? This would be the acquiring applicant for the one application number 123456. They would submit that on sequence 0006. And then on 0007, the acquiring applicant takes up business as usual on the new application ID, the CA, and then at the end, the DB. And then the previous applicant ABC would then proceed with application number 123457, which was not part of the TO, which was not sold to the acquiring. They would proceed with business as usual in their in their initial application ID folder, and they would proceed with 0005 and not submit a baseline. So it would be business as usual for them at 0005, whereas for the new applicant, their business as usual starts at sequence 0007. Thanks, Dogozo. All right, now let's have a brief look at the splitting of an eCTD. So a bit of similarities with the partial TOAs. So you shouldn't have any open submissions when you are splitting your eCTDs. You would then need a new application ID as well when you do a split. Let's say, for example, if you're having a 10 milligram and a 20 milligram and you're splitting those, you would need a new application ID for the other, because now you're splitting, you're going to end up with two eCTDs. They need to be in two separate application ID folders, right? And then you would do one baseline, which would be for the new application ID as a next sequence. And then you would also submit a variation that is causing that next sequence, the likelihood, or for example, if you're having a downscheduling of the one strength. Thanks, Ndogozo. Right. So let's look at how that looks in terms of the sequences and activities. So in your 0001, you're submitting an eCTD with your 2 strengths and 2 application numbers. And then in 0002, you get an approval from SAHPRA, and then you're submitting a type 2 variation at 0003. But then now you have to split the strengths due to a line extension, for example. So then you would submit in 0004, you would submit a withdrawal of the type 2 variation, which you had done in sequence 0003, and you would state that the withdrawal, the sequence description would be that this is due to an eCTD application split. And then in 0005, you would then submit a new eCTD application, and your submission type would be, for example, a line extension, and the new application with the letter of application detailing the reason for the split. So, for example, if you then the 10 milligram has a down scheduling, then you would state that in your cover letter in the 0005. Thanks, Ntokozo. Okay, and then in your sequence 0006, you would then submit a baseline with all the approved content from the previous sequence 1 to 5. And so if you have any open submissions where you have you had to do the withdrawals before the split, this should then not be included in the baseline because these were withdrawn and not approved. Okay, and then approval of the new application would be given possibly after a few back and forths. And then at sequence 0007, you would undertake business as usual with the new eCTD application. And then the previous one, undertaking the business as usual, would be at the sequence 0005 on the original eCTD. So on the original eCTD, you wouldn't then do a baseline. Your business as usual would be on sequence 0005. And if open submissions were withdrawn, then you would need to resubmit these under a new submission, but files previously submitted should then only be referenced, and they should not be physically provided. So if you had done withdrawals prior to the split or because of the split, then you would need to resubmit those variations because they wouldn't have you would resubmit, but you would reference them instead of adding the actual documents in your sequence. Thanks, Ntokozo.
Good morning, ladies and gentlemen. It's me, Madeleine. So I will be taking you through the multiple applications and the withdrawals and some of the rest. So we're just going to define the replicas, clones, duplicates. I think what we've seen is that there was a bit of a dissociation. It was never defined. So you will see also in the Spec 3.1 that was clearly defined what is a replica, what is a clone, and what is a line extension. So a replica is an already registered generic product. It can only be submitted by the same applicant. So another company cannot submit a replica to SAHPRA. In that case, it should be a new application, or it can be a duplicate that they buy from another applicant. Application IDs is the same as the masters. So you use the same application ID. So that's the same little folder. It has a different proprietary name and application number. And you will also submit it during your life cycle of your submission. So, if, for instance, if you submit it as if you got registration in sequence 5 and you want to add your replica in sequence in the next sequence, that is where you do it. You do it in sequence 6. A clone is an innovator it's an already registered new chemical entity, and you want to add another clone to that specific product. It has a different proprietary name and application number. You will do the follow-up sequence of the original registered one, the same as the replica. So they have the same process, they just name differently due to where they origin from. And then the application ID will still be the same as the master application. Then duplicates. A duplicate is an innovator, a generic, or a biosimilar product. So you submit a duplicate at the same time as you do your new applications. This cannot be submitted during the life cycle of a product. So this is with initial application. You do your duplicates. You also apply for the duplicate application numbers during application of your initial application numbers. So this is defined as 2 or more applications submitted simultaneously by the same applicant. They are identical in every aspect for the proposed proprietary name, and they are then submitted at the same time as the master application. There were questions previously, what is a master, what is a duplicate? On your application letter from SAHPRA, they have a definite definition or differentiation between your master and your duplicate application numbers. When the portal goes live, you will also see that there is a space where you can say, okay, I'm applying for a duplicate. I tick this box, and these are the strings I'm adding as a duplicate, and they will then provide you with these application numbers. Then if the duplicate is same time as the master, the replicas are cloned with the master as the next sequence. The master details are in the envelope, but there's also the additionals will be added under the multiple submissions. So when you do your envelope, the 3.1 envelopes, we always, and it's actually very unique to SAHPRA, is that we have our application numbers at the top, and at the bottom there's multiple applications. It's very unique to SAHPRA. The rest of the world adds everything under application number, but at SAHPRA we're going to add the multiples under the multiple submissions. So where your clones, replicas, and duplicates will be added there. Okay, then we are on line extensions. So we've got 3 different line extensions added, and I'm very excited about this because this was something I learned a lot from. We've got the line extension for a new string, so that's when I'm adding a new string to my already portfolio. A new dosage form, so you are moving from, you adding a tablet and you have a capsule, or maybe it gets to be a solution for infusion or something like that. You're adding a dosage form. Or a new route of administration. A good example is a pessary versus oral administration. So you will have those 3 ones. We also have the new application one, where you will add during the partial baselines or the partial submissions, withdrawals that you'll submit a new application line extension. So you use that during those. Other than that, you use these new string, new dosage form, new route of administration. Each of them have their own life cycle. For instance, a new dosage form and a new route of administration will actually be a new application. So they will go through the new application process, but you can imagine that there's kind of reliance already going into play because there's already a registered product. So your 3.2S is already approved, so that section doesn't need to be re-evaluated by SAHPRA. However, your 3.2P, which indicates this new dosage form and the route of administration, obviously needs to have some evaluation. Where your new strength is part of a variation. I'm adding a new string because most of the dossier is already approved with that. You just obviously need to include your efficacy studies or your bio waivers for this new strength into your product life cycle, that they can be evaluated as such. Then cancellations and withdrawals. So we've got 2 different types of cancellations. So first of all, we've got a cancellation for application, and there would be one for submissions. If you can remember, we previously shared that diagram about what is application, what is submission, what is sequence, right? So in this case, we're talking about the application. I'm ending my product in market. So I'm withdrawing it from the market. So I'm going to submit. My submission type would be application withdrawal. My sequence type is initial. My description is going to be cancellation. And I just include a letter of application to SAHPRA saying, listen, I'm taking this off the market. I'm canceling this product. And this is also very important when we get to retention fees and all of that, because this thing speaks to the system gives a report to the finance office, and they would know, listen, these were cancelled in the last year, and it's easy to keep track of it in this regard. Then we have the submission withdrawals. So this is something that happens quite often, is that, oh, oops, I made a mistake in my submission, or, oh, goodness gracious me, we are only going to have a new site in the next year. We planned it for this year, but it's only going to be in 2025. I need to withdraw that submission. So in my envelope element, my submission type will be the same as the related sequence. So if I submitted a type 2 in sequence 1, then my sequence 2, my withdrawal will be, the related sequence will be 1, my submission type will be the same. It would be that type 2. My sequence type would then, the sequence type would then be submission withdrawal, and I would state the related sequence initial is the initial sequence of the submission, as I explained. In my lifecycle rules, my letter of application will then be nude, and the replaced content reference previously submitted, you do not resubmit it, and you delete the content that you submitted in your sequence 1. So if my sequence 2 was my my withdrawal, I would go and my sequence 2 and do the delete content, the delete lifecycle operation. So you do not remove the node, you do not remove it from the structure, you're just going to include the delete lifecycle of that specific node. Okay, I can go to the next slide. Okay. And then we are at the Q&A. Is there any questions we can attend to? I've answered a few already in the chat. So maybe just those that we didn't get to.
Thanks, Madeleine. Thanks, Don. I'll just go through some of the questions in the chat, and then we'll just answer as we go along. First question, would the relinquishing sequence need to be approved before the transfer of applicant sequence can be submitted by the new applicant? Or can these be submitted after technical validation pass notification?
Yeah, so pretty well I've answered this one.
Okay.
Just on that note, there is a short delay because the new application needs to move to the new applicant. So it's a portal moving of things. So as soon as that relinquishing comes in, there's a short delay between the two for the acquiring applicant to be able to upload the acquiring sequence.
So just one moment. Lots of them are already answered. Okay, there's one. As per point 4.2 of the Reliance Guideline, there is an independent application of reliance for quality and bioequivalence and clinical. If the applicant is following an abridged evaluation for clinical, but full review for quality, which evaluation pathway should be selected in the trigger file?
Oh, sorry, it was me. The evaluation pathway is the abridged pathway.
Abridged for clinical.
Yes, for
Right.
both of them, it's you choose one evaluation pathway, and it's going to be the abridged one at this point, that they know there is a reliance mechanism at play.
When submitting a baseline, why submit a baseline by splitting the dossier? MA holder already submitted all documents with previous submissions. If the dossier is splitted, it may be new MA holder will get all the previous submissions from former MA holder.
So this is because when you split in your eCTD, you now literally have two separate eCTDs, and for lifecycle management purposes, those are also now being managed separately. So you can't now start doing business as usual on the new one it's going to start looking for all the previous documents in the previous sequences, and the previous sequences are not there. So you need to have the baseline in place before you can then do follow-up sequences.
Why must a replica be submitted by the same applicant? According to the multiple application guideline, a replica is a copy of an already registered generic product submitted by the same or by another applicant at any stage during the product life cycle of the registered product. So why must a replica be submitted by the same applicant?
So this one is what we addressed in the new specs 3.1. So we had a few discussions on that. It's due to the life cycle. My suggestion in this regard is that the initial applicant would submit the replica as part of it and then do a TOA to the acquiring one. It's due to the life cycle of it. It's difficult to manage the life cycle if a replica is submitted in sequence 4. However, you do not have the rest of the applications or the submissions in your life cycle. So that's why this was addressed in the 3.1. We will definitely look at the multiple applications guideline again.
Next one, there's quite a few questions by the applicant. You've mentioned in the previous workshop the Q&A document on the eCTD portal website would be frequently updated. Kindly advise on the next update publication, as it hasn't been updated since V5 in April. So I'll take that one. We are currently working on another update to go onto the website, but it will very likely only be early October, as there's a lot of moving parts at the moment, especially with the portal that we're working on, as well as 3.1. But we do need to include the latest Q&A document for the applicants on the website. The next question, for transfer of applicancies, kindly clarify why the sequence type is pharmacovigilance and not inspectorate.
So just on the pharmacovigilance, remember when a pharmacovigilance notification is received from SAHPRA, it goes to the applicant that has the product in their hand. Right, so it is your responsibility as a relinquishing applicant to submit that outstanding pharmacovigilance notification from SAHPRA before sending it to the next applicant. So that's why the sequence type is pharmacovigilance. It goes to the pharmacovigilance team, and that is why it's according to that submission type, sequence type, and all of those.
With PV reports being part of a dossier with all the submissions, will all the submissions be done in an eCTD sequence? With PV reports being part of a dossier, will all the submissions be done in an eCTD sequence?
A short answer there should be yes.
Okay, thank you. Are all PV submissions interactions to be done by regulatory in eCTD? And will the SAHPRA PV email address still be used for SAHPRA responses? I'll take that. Are all PV submissions interactions to be done by reg in eCTD? Yes. And will the SAHPRA PV email address be used for PV responses? Again, short answer is yes. The next question, for eCTD splitting of application, does it apply to a dossier with two products with the same strength and dosage form but different presentations? For example, a vial and a cartridge.
Yes.
Okay. Thank you. Right, next one. Will applicants be required to pay a fee to withdraw a variation previously submitted? And can the fees that were paid to SAHPRA for the previous variation be reallocated to an alternative sequence? Instead of submitting a withdrawal sequence to withdraw a variation, can the applicant just inform SAHPRA of the withdrawal of the variation with the transfer of applicancy or eCTD split to reduce admin? So I think just to answer this, we are actually waiting for the new fees to be gazetted, and thereafter we will reach out to the applicant. So just with regards to a fee being paid for withdrawal, etc., we will confirm as soon as the fees are gazetted. Next, for withdrawal of submission, if you delete the document, will that then automatically still have the previous version, or will that node be completely deleted?
Okay, so the correct way of doing a deletion on the eCTD is you never delete the entire section. You delete the documents so that that delete lifecycle operation would reflect in your eCTD. So even with the withdrawal, the deleted documents would then still reflect as deleted. They wouldn't then necessarily be there.
Here, then the next question, owing to the fact that a line extension has already been partially evaluated, will the approval timelines be shortened? So I think with this regard as well, we'll come back to you. We are actually looking at all our timelines at the moment. Right, the next one, deleting documents. Oh, I think, let me just have a look if this is answered. No. Okay, deleting documents is not currently reflecting on the XML for version 3.1. How would SAHPRA manage the current view on the internal viewer when applicant deleted documents? Kindly advise.
SAHPRA can still see all the documents in the life cycle. It's not a document, it's never removed. They will still be seeing the previous version that was in that node. So there's nothing, it's not gone. It's still viewable by SAHPRA.
Bearings here. All right, next one. All right, so what is the current timeline for approval of new registrations and line extensions? So that's not part of this discussion. Next question, when withdrawing a sequence, it's clear that new documents in the related sequence should be deleted. Kindly confirm that we can keep replaced documents. Some clarity is required in this regard. When withdrawing a sequence, it's clear that new documents in the related sequence should be deleted. Kindly confirm that we can keep replace documents. Some clarity is required in this regards.
So you apply the life cycle of delete on the replaced documents as well.
Got quite a long one. Let's consider the following scenario. We have an RMP in the current view submitted in 1.13. We have to submit a new version mid-October. That means using the DTD 3.1. RMP is then in 1.82. We know we can't replace in 1.13 since this section is no longer exists in 3.1. I would then logically mark as delete the superseded RMP in 1.13 and have the new version in 1.82. The outcome is that the delete operation won't appear in regional XML. And that means the superseded RMP will stay in the current view at the agency level. What is the solution for this?
So 3.1 is as flexible to view the 2.1 as well. So if you apply the delete operation on a 2.1 going to a 3.1, it will be visible on SAHPRA side, delete operation, and then you would have your new 1.82 reflected in, the RMP will then be new in 1.82.
Okay, so just to add on to what Madeleine has responded to. So with all the moves where things have moved from the 2.1 have moved into new elements within the eCTD structure, you always want to make sure in the old or in the current structure, you do the delete operation and then you add them as new in the new location. That's how we're going to manage the life cycle around the nodes that have moved around in 3.1.
Right. Next question. Since now the replicas can be submitted by the same applicant, what will happen to replica submissions submitted at SAHPRA by different applicants? Now the replicas can be submitted by the same applicant. What will happen to replica submissions submitted at SAHPRA by different applicant?
If it was submitted like that previously, they continue with the life cycle. It's just on the new process that it will be as per indicated.
Where there are two separate eCTDs, two different dosage forms, and now a PI-PIL safety update is submitted, the PI-PIL is a combined PI-PIL, has both dosage forms. Do we only submit the safety update variation once? And do we need to submit the same variation for each dosage form as next relevant sequence number?
Pratibha, from my industry experience is that you would submit in both applications because they're two different applications, and your package insert has to go with the relevant application number or registration number on the PI, so you have to submit it in both.
That I agree with. There will have to be two different submissions. SAHPRA has communicated that applicants are to submit using eCTD 3.1 from the 1st of October. However, comment has been made here that SAHPRA will inform industry of when to submit. Does that mean industry may submit using the current version until 3.1 implementation is communicated, even if it's after the 1st of October? So there is communication that we are preparing to go out for next week, and we will clearly define how applicants are to proceed with 3.1. Okay, the next one, when submitting a clinical variation unrelated to a response to a PVC letter, should the submission lead be PV or orthodox in the trigger file? Clinical variation unrelated to PVC. Should the lead be PV or orthodox in the trigger file?
Orthodox or biological, so with whatever the unit it's submitting the clinical to.
Thank you. Please confirm the industry workshop launch of the SAHPRA engagement portal will take place on the 20th of the 9th, 2024. So that I'm confirming that will be happening next week. Next question, according to SAHPRA document matrix version 2.1, for a new chemical entity and a new generic, it is indicated that the PI and PIL should be included under the relevant annotated section, as it is indicated as E. In the ZA SAHPRA eCTD specification version 3.1, line 1528, it is, however, stated that the product information for new applications should be placed in the approved section. Please clarify, as this is contradicting the document matrix.
We will have a look at the document matrix. We have also something else up, so we will have a look. Thank you, Anita.
Okay, just looking for more questions. When will this new transfer of applicancy submission be implementable? Until when will submission of transfer of application in previous way be acceptable? When will this so when version 3.1 goes live, the new way of working will be implementable and you continue as current for now. Don't know if Madeleine wants to add to that.
No, that's perfectly what you answered, yes.
Okay, next one, do we have a guideline on line extensions? If some docs in 3.2S are different, does it still qualify to be a line extension application? So actually, no, we do not have a guideline. So that is on the list of guidelines that we will be creating. If some documents are different, then it's very likely it will not qualify, but let us look at that and we will come back to you. Okay, the next one, please clearly address the question regarding different evaluation pathways for quality and clinical in the full updated Q&A document for future reference. Okay, thanks, Anita. The next, that delete operation doesn't work. It's just a statement. Okay, will renewal guideline be updated to align with the new eCTD specification? Yes, that is currently underway. Madeleine, you're coming off mute.
Sorry, I'm just looking at the delete operation doesn't work. We will then just investigate and get back to you or address it in a Q&A.
Will the switch to version 3 be immediate, or will a window period be allowed where both version 2 and 3 submissions be accepted? I think you can take that, Donna, Madeleine.
The date of the mandatory 3.1, that will be communicated in SAHPRA. They're busy with compiling a communication out to industry. So when there will be a time where there's probability that between version 2.1 and 3.1, there will be, you can submit in both ways, but there is a time where it gets mandatory to submit in 3.1.
Yeah, so with some of the internal communication I've seen also, those kind of transition periods would probably be included in the communication that's going to go out next week.
Next question, will guideline 2.24 be updated in line with eCTD 3.1? And the answer is yes, it will be. Next, according to SAHPRA document matrix version 2.1, the tabulated schedule of amendments is indicated as E. For a new generic multi-source, please clarify what should be submitted here, as everything is new in a new application and there won't be any amendments.
Yeah. So this is the other one we spoke about earlier. Anita, we picked this one specifically up and we will look at the document matrix.
Delete operation on sections that no longer exist in 3.1, don't appear in the XML, so won't be processed at the agency. There is a bug in the DTD.
We'll answer the specific delete operation in the Q&A then, seeing that they think there's a bug.
Is SAHPRA going to give us a preview of what the new portal will look like so that we can see what the endpoint looks like? Yes, that will be next week, Friday. The invites will be sent out later on today. Okay, will all today's discussions be included in the Q&A doc or guideline? It is quite a bit of new information, which can be a bit confusing. So yes, we will include it in the Q&A. Next, I have a line extension with publishing team that I'm hoping to submit by the 30th of September. It's in the old format. Will it still be accepted if version 3.1 goes live before the 1st of October? So please, if it's before the 1st of October, kindly submit in the old format. Thank you. The next one. According to the SAHPRA document matrix version 2.1, 1.10.4.2, declaration of sameness, and 1.10.5, RRA reports are indicated as E for an NCE, a new generic. It should be a P. It's not all new applications would follow a reliance pathway, and RRA reports and sameness declarations would not be applicable.
I agree. Yeah,
okay.
We'll look at that.
Look at that. Okay. Next one. According to the last workshop, confirmed about the release of version 3.1 specs with minor updates. Can you please advise the release date of this specification?
So we discussed Pratiba, it will probably be in next year. Just to note on the minor updates, it's just typographical updates. There's no schema updates, so there's no technical updates. If it's a technical update, it would be go to version 3.2, then it would be considered a major update, but minor updates will only be typographical or maybe some clarification on things, but it's never a schema or a technical update.
We know the release date of Q&A document in the website. I think I answered that. It will be early October. Okay. How are we doing for time? We have 8 minutes and no more questions. Questions? Okay, this is good for time. So I think you've heard that there is a SAHPRA engagement portal meeting similar to this webinar. It will be next week and next week Friday, and we will be sending out that communication after this meeting. I see there's a hand up. We're not taking hands. You do need to include your question in the Q&A. Please. Okay. All right. Okay. All right, there's. Okay, all right, it's coming in again. E's are included for several submission types next to 110.4 data set similarities in the document matrix. Please clarify as documents should be included at the lowest level of granularity defined as per SAHPRA eCTD spec version 3.1 lines 473 and 474.
Yeah, Anita said we will look at the document matrix. We realize there is a few discrepancies.
Then could you please indicate whether application for a new username and password for the new portal needs to be applied for, or is it the username and password received by the RP after completion? After completion, all the required documents still valid. So yes, please join next week, Friday, and we will give you the full indication on how to proceed with registration on the SAHPRA engagement portal. Right. Next, will the replicas currently submitted by different applicants be approved by SAHPRA?
If they're already submitted,
If they're here.
Yes.
Right. Kindly review validation criteria 218. It validates the rule against the sequence type field. It seems incorrect, seems it needs to check against submission type. Okay, I think that's just to note. Kindly review validation criteria, that's noted. Do the guidelines specify how to combine a submission for master and duplicate?
I think this relates to a previous question. This person asked previously, they asked if they can combine a master and a duplicate already submitted to SAHPRA's two different applications. My advice is to engage with SAHPRA to ask this. I know there were already a few requests like this to SAHPRA, and depend on what is in the different applications. Would they advise you, yes, you may, or you may not? And then they would also specify how you combine these two submissions.
Advise on the publication of eCTD 3.1 updated application letter and note to evaluator templates. Can you advise on the publication of the eCTD 3.1 updated application letter and note to evaluator templates?
There's no specific templates for these. No, so there won't be any publication of these. So requirements is as per what's indicated in the specification. Your note to evaluator is basically telling your evaluator what you have done in the application. For instance, if you have how many 3.2Ps you've included, what is in your 3.2S section, and you have so many APIs. So your note to evaluator is telling your evaluator exactly what you have done. And your cover letter is your cover letter, your application letter. It's what it previously was. It would be kind of exactly the same as you previously submitted.
Is submission of a trigger file already mandatory, or will this be applicable on the 1st of October?
The trigger file was mandatory from April.
April.
Yeah, so this is a interesting question.
Okay. I do think
just to note, to add on, because the assumption will be that they have not submitted a submission since April. When the portal goes live, it will be automatically creating these trigger files based on what you would have completed when you log on to the portal to prepare for your submission. So I think the worry here would be the entire process of creating this trigger file. If you've waited since April to do a submission, I'm sure you can wait for the portal to go live. Then you don't have to deal with the creation of the trigger file. The portal will create for you.
Thank you. So thanks everyone. We quite did quite well with our time today. It's 09:58. As mentioned, next week Friday is the SAHPRA Engagement Portal webinar, so please try to join. And the recording of today's webinar will actually be on the events page, SAHPRA events page. So thank you, everyone. Have a lovely Friday. Bye.
Thanks, everyone.
Thank you. Bye-bye.